Welcome, brothers and sisters, to your wellspring of knowledge. Remember that knowledge never be toxic to brain, but public serving and saving oriented. I am by the names of Joseph Udeshime. Welcome back on our channel Medicine and Health Initiative Center. Today's topic is neuromuscular blocking agents. Let us go on. We are going to see different things. What's neuromuscular blocking agents? What are the indications? What are the skeletal muscle relaxants, sites of action of neuromuscular blocking agents, and the normal neurotransmission of acetylcholine in the neuromuscular junction. Hello friends, what is neuromuscular blocking agents? It's a group of drugs that induce relaxation of skeletal muscles by interrupting the impulse transmission in neuromuscular junction to produce or to cause paralysis of the affected skeletal muscle fibers. Friends, you have to remember that neuromuscular blocking agents do not have analgesic or amnesic properties. Only relax the muscle and plate fibers. On the point of indications, we use neuromuscular blocking agents for three main reasons. One, to facilitate tracheal intubation. Second, we can use them to facilitate or to make easy mechanical ventilation of the patient during surgery or in ICU settings. Third, we can give muscle relaxant to patients once we need to optimize the surgical working condition for the surgeon. Friends, these are the main muscle relaxants or groups of medication that have ability to produce relaxation of muscle. One, we have NMBAs or neuromuscular blocking agents administration. As you have seen, it relaxes skeletal muscle via nicotinic receptor. Second, deep inhalational anesthetic. It has this property, but you have to remember that nitrosuccess does not have this property. But all other inhalational anesthetics on deep mark, you get relaxation of smooth muscle. Third, we have regional anesthesia via nerve root fiber. Friends, what are the main sites of action of neuromuscular blocking agents? First one, we have prejunctional receptor action, where the neuromuscular blocking agents inhibit or block the acetylcholine release or synthesis. Second, you have postjunctional receptor action. What happens here? The neuromuscular blocking agents blocks the action of acetylcholine on the nicotinic receptor and then cause relaxation of smooth skeletal muscle via depolarizing or via non-depolarizing action. Yes, very interesting. Acetylcholine physiology. How does it work in the neuromuscular junction? Friends, you have to remember that acetylcholine is a neurotransmitter responsible in the neuromuscular junction transmission. which is synthesized in cytoplasm by combination of molecule choline and coenzyme A under function of enzyme called choline acetyltransferase. And this acetylcholine, once is synthesized, it gets stored in the vesicles for control release. Okay, now what happens when the nerve action potential gets started? As the action potential of the nerve depolarizes its terminal, the calcium ions gets into the nerve cytoplasm via voltage, get the calcium channels to allow the storage vesicles to fuse with the terminal plasma membrane and release their contents, which is acetylcholine. Once this acetylcholine is released, they diffuse across synaptic cleft to bind with nicotinic receptors at the motor endpoint to produce post-junctional action potential in muscle contraction. The structure of acetylcholine receptor. Friends, you have to know that each acetylcholine receptor in a neuromuscular junction normally consists of 5 protein subunits, where 2 or 5 are alpha subunits and single beta, delta, and epsilon subunits. And only 2 identical alpha subunits among those 5 subunits are capable of binding acetylcholine molecules. You have to know also that if both binding sites, there's 2 alpha subunits are occupied by acetylcholine molecules, the conformational change in the subunits opens ion channels. And you have to know that the channel will not open if acetylcholine binds only one alpha site, to mean that 2 alpha subunits must be occupied by acetylcholine or other medication like neuromuscular blocking agents. Now, this is sodium. This sodium, as you know, they are the transmembrane protein channels, and they are in higher concentration around the junctional area than other parts of the membrane. Sodium gets of 2 types. You have voltage dependent and time dependent. And sodium ions only pass when both gates are open, to mean that when one of the 2 gates is not open, the sodium ions are unable to pass in through. Friends, these are the gates. We have upper gates, we have lower gates. This is the membrane. This is it's the transmembranous sodium channel. As you have seen, sodium channel is a transmembrane protein that can be conceptualized as having 2 gates, upper and lower gate. Sodium ions pass only when 2 gates are open. The opening of gates is time dependent and voltage dependent. You have to take care of this point. Time dependent and voltage dependent. We will see much about this with the neuromuscular blocking agent, because For example, the polarizing types of neuromuscular blocking agents act via this point. The channel therefore possesses three functional states. We have at least depolarized and inactive. At point A, when there is no impulse passing, the lower gate is open but upper gate is closed, to mean that there is no sodium ion passing here inside, because we have seen that two gates must be open. Second, these sodium channels reach threshold voltage depolarization. The upper gate is open, sodium can pass. C. Shortly after the upper gate open, the time-dependent lower gate closes. Now what happens? What happens with the opening of sodium channels? The entry of sodium and the calcium takes place, where the calcium is also released from a cytoplasmic reticulum, and this and as you have seen, this intracellular calcium allows the contractile proteins acting myosin to interact, bringing about muscle contraction. Muscle contraction. This is the normal physiology of acetylcholine. Now, this is a neuromuscular transmission chart that can summarize all things you have said. What happens? Friends, when the nerve action potential is transmitted, the nerve terminal vertebrates is depolarized. The acetylcholine is released from storage vesicle, the nerve terminal, and the enough acetylcholine is released to bind to 500,000 receptors in the muscular junction. Acetylcholine molecules bind to alpha subunits of the acetylcholine receptor on the post-junctional membrane, generating a conformational change. Yes, you have seen. And after producing this conformational change, the opening receptor channels takes place, and the receptors do not open unless both alpha receptors are occupied by acetylcholine. I've seen all those in the previous. Sodium and calcium flows through the open receptor channel, generating the end plate potential. Now, what happens when between 5% and 20% of the receptor channels are open? A threshold potential is reached. The voltage gets sodium channels within the pre-junctional portion of the muscle membrane open. When a threshold voltage is developed across them, the muscle action potential is generated, and of course the acetylcholine is rapidly hydrolyzed into acetylcholine by substrate-specific enzyme acetylcholinesterase in the neuromuscular junction. After unbinding of acetylcholine, the receptors ion channels close again, permitting the end plate to repolarize, and the calcium is sequestered in the cytoplasmic reticulum, and the muscle cell relaxes. Friends, thank you for this time you have taken learning about the introduction to neuromuscular blocking agents. Remain with us and let us learn together for safe practice and knowledge. Stay with us for the next topics of this, where we'll be discussing on medications, classification of non-depolarizing and neuromuscular blocking agents. Thank you.